why women are more prone to have arthritis?
The thing is their body built,
अच्छा।
their basal metabolic index and their lifestyle.
और एक आता है कि arthritis और knee pain, ये दो अलग चीज है या दोनों एक?
नी पेन के लिए बहुत हजारों रीजन से हो सकती है. बोन्स आर the structural composition of your whole body and your system.
It is my own plasma taken from some other part of the body.
So taken from your blood, your own blood.
Indian sitting style, like sitting on floor or lifting something, are they doing in the right posture?
Western people generally suffer from hip arthritis. We Indians suffer from knee arthritis.
The gym exercises, people work out a lot. So in that category, does joint pains happen?
Gym is good in a lot of extent. Better bones and joint health.
So why are fast bowlers having those ligament wear and tear in there?
When he is landing over the squeeze and delivering go. So a lot of stress and strain is happening over the knee joints.
So welcome to the mouth of India. आज हमारे साथ जैसे कि आप जानते हैं कि आज हमारे साथ एक डॉक्टर है जो ऑर्थोपेडिक सेगमेंट में काम करते हैं. वो डॉक्टर आपको दूसरा सेगमेंट में जानकारी देते हैं, जैसे कि बस 18 से 30 साल तक जो लिगामेंट टेरिया हो या आपका स्पाइन का प्रॉब्लम हो, उसके लिए आपको हेल्प हो जाएगा ये वीडियो. और आता है जो एज ओल्ड कैटेगरी, लाइक अपने माँ बाप हो या किसी के एज ओल्ड कैटेगरी में आर्थराइटिस प्रॉब्लम हो या घुटने का दर्द हो या बैठने का पोस्चर हो, सभी में आपको इस वीडियो में पूरा जानकारी मिलेगा. सो चलिए स्टार्ट करते हैं अपना पॉडकास्ट. सो एंड तक बने रहिए और जो भी लाइक शेयर कमेंट हो बिल्कुल करिए. तो वेलकम सर, वेलकम टू द माउथ ऑफ इंडिया.
Yeah, thank you. Been following your channel since long, few months more than. It's been good content. Yeah, it's been a great pleasure to be in the show.
Sir, just we wanted to know that in our house, our mother or anyone's age-old persons like grandmas or these age categories, they pursue a lot of this thing leg pain or knee joint pains. So you have any suggestion for them?
Basically it's about the lifestyle modification. See, whenever there is a old age patient category, they are more prone to degenerative kind of arthritis. So basically what happens is, due to age related changes, there are lot of wear and tear in the joints, so that will lead to arthritic changes. Some of the home remedies are, we call it as lifestyle modifications. So basically what lifestyle modification they can follow is that, so change in the diet, increase the calcium uptake, good nutritional food intake, and moderate activities like walking, moderate walk, brisk walk. This will help. And posture is very important. So considering the posture of the patient, what they are following. So posture is very important to avoid the spine related issues as well as knee related injuries. So if they are into more in the terms of weightlifting rather than and squatting, cross leg sitting, so these will more faster the speed of the process of arthritis. So these are the some home remedies they can take care of that to prolong the arthritic issues.
सर, जैसे कि आपने भी सुना होगा कि अपना जो ओल्ड मूवी में रहता है मुन्ना भाई एमबीबीएस में बोलता है कि सर के 206 हड्डियाँ रहता है, तोड़ने के टाइम ही पता चला है मेरे को करके. सो what are those importance of 206 bones in the body for the skeletal momentum?
So basically देखिए, bones are the structural composition of your whole body and your system. So we look alike as a human species, so bones are important. The alignment, the anatomical considerations. So these are all the anatomical. Say for example, your elbow is aligned in this way because you tend to carrying the weight. Okay, your knee are aligned in this way so that you can walk, run, jog, and do the day-to-day activities. You can squat, cross leg because of the alignment of the ligaments and the other issues. So structurally, the bones are the structural and the composition of the body, so that we can do our day-to-day life activities with confidence.
सर, और एक आता है कि आर्थराइटिस और नी पेन, ये दो अलग चीज है या दोनों एक ही है सर?
सी, इट्स टोटली टू, दोनों भी डिफरेंट एंटिटीज होती है. देखिए, नी पेन के लिए बहुत हजारों रीजन से हो सकती है. देखिए, कुछ ट्रॉमेटिक इशू हो सकता है, मतलब कुछ चोट लगा है, गिरा है, उससे भी नी इंजरीज हो सकती है. और कुछ कार्टिलेज डैमेज से भी अर्ली आर्थराइटिस, जिसे यंग यंग में होता है कॉन्ड्रोमाइलिस पटेला करके, आपका जो यहाँ शिन बोन होता है ना, शिन बोन में कार्टिलेज चेंजेस होके आर्थराइटिस हो सकता है। ओके, और ऐसा है। और जैसे कि स्पोर्ट्स इंजरी जैसे मैं बोल रहा था, इसमें लिगामेंटल इंजरीज हो सकते हैं, ये एंटर क्रूशिएट लिगामेंट होता है, इसका भी इंजरीज हो सकता है, ये मेनिस्कल इंजरीज हो सकता है। सो दीज आर कोलैटरल लिगामेंट करके हो, इसका भी सो इंटरनल डीअरेंजमेंट इश्यूज करके वो बोलते हैं हम, सो इसका भी इश्यूज हो सकता है। सो दीज आर ऑल द नी पेन, दीज आर कंडीशंस कॉजिंग द नी पेन। कभी कभार क्या होता है, कोई चोट लगा है और कोई फीवर का हिस्ट्री है, उससे क्या होता है, इसमें घुटनों में पानी जमा हो जाता है, सो दैट इज नी एफ्यूजन करके बोलते हैं। इस कारण से भी घुटनों में आर्थराइटिस हो सकते हैं। और लॉन्ग स्टैंडिंग फीवर के बाद में जो वायरल फीवर होता है, उसमें भी नी प्रॉब्लम, नी प्रॉब्लम्स होते हैं। सर ये सब नी पेन का कॉजेस होता है। पर बेसिकली हम आर्थराइटिस के बारे में जानकारी देना चाहते हैं। मतलब बेसिकली क्या होता है, आर्थराइटिस मतलब वेयर एंड टेयर बढ़ जाता है इसमें, इस कार्टिलेज जगह में।
जैसे रब करते हैं घुटना हमारा, इट विल वेयर एंड टेयर।
या जस्ट द वे द ओवर द पीरियड देयर इज वेयर एंड टेयर ऑफ द जॉइंट। कि बेसिकली क्या होता है ना, आर्थराइटिस के बहुत सारे कारण हो सकते हैं, जैसे संधिवात, रोमेटॉइड आर्थराइटिस बोलते हैं, गोट आर्थराइटिस मतलब आपका प्यूरिन पिरामिड मेटाबॉलिज्म से भी होता है, जिसमें क्या होता है, ये इन्फ्लेमेटरी आर्थराइटिस करके बोलते हैं। इसमें क्या होता है, जो इन्फ्लेमेटरी मीडिएटर्स होता है ना, वो जाके आपको जॉइंट को अटैक करता रहता है। सो इसके लिए आपका आर्थराइटिस प्रॉब्लम फास्टन हो जाता है। मतलब छोटी उम्र में भी नी पेन आना है, अर्ली मॉर्निंग स्टिफनेस आना, और काम करते करते घुटनों में ढीला हो जाना है। सो दीज आर ऑल इन्फ्लेमेटरी आर्थराइटिस कॉजेज, रोमेटॉइड आर्थराइटिस, स्पॉन्डिलो आर्थराइटिस। सो ये एक कारण होता है। दूसरा आता है एज रिलेटेड आर्थराइटिस। इसमें क्या होता है ना, मानो अपना घुटनों के सराउंडिंग क्या होता है ना, इट इज सराउंडेड बाय साइनोवियल फ्लूइड। मतलब अपना मूवमेंट फ्री करके के लिए साइनोवियल फ्लूइड जमा रहता है, ठीक है। वो साइनोवियल फ्लूइड में कम मात्रा में पानी कंटेंट कम होते होते इसके लिए विस्कोसिटी बढ़ जाता है। बिकॉज ऑफ दैट, सो देयर इज अ कार्टिलेज डिग्रेडेशन, hyaluronic acid करके हम कहते हैं। सो दैट hyaluronic acid is degraded with age, so there is a cartilage wear and tear. So as a result the cartilage gets wear off, and so joint space कम होता है, बोन से बोन कांटेक्ट बढ़ जाता है, इसके लिए फ्रिक्शन बढ़ जाता है, और आर्थराइटिस पेन स्टार्ट होता है, नी पेन स्टार्ट। जाते जाते क्या होता है ना, ये जॉइंट फेस कम होने से एनाटॉमी डिस्टर्ब होता है, इसके लिए लिगामेंट के ऊपर बहुत ज्यादा लोड पड़ता है। सो मानो आप देखे होंगे बूढ़े लोग, उनका घुटना स्ट्रेट नहीं रहते, उनका थोड़ा वेरस में हो जाता है, मतलब
ऐसा रहता है ना,
हाँ, इसका बो लेग करके बोलते हैं ना। अच्छा, तो वो भी हो जाता है विथ इग्नोर्ड आर्थराइटिस फॉर लॉन्ग टाइम।
सर वो बो लेग के बारे में आपने कहा ना, ऐसा तो उसको क्या आप ओपन करके फिर से आप जोड़ देते हो, कैसे करते हो?
सो बेसिकली these patients are more considered for going for total knee replacement, जिसमें क्या होता है ना, तो बो लेग हुआ रहता है, जॉइंट फेस कम हुआ रहता है, उनका वॉकिंग डिस्टेंस कम हुआ रहता है, उनका लाइफस्टाइल में मॉडिफिकेशन का कुछ बहुत जरूरी चीज है, मतलब उनका एक्टिविटी कम हुआ रहता है, वॉकिंग डिस्टेंस दे कांट इवन वॉक फॉर 500 मीटर्स एंड ऑल। उसमें क्या करते हैं हम, विल प्लान फॉर टोटल नी रिप्लेसमेंट। सो टोटल नी रिप्लेसमेंट में हम क्या करते हैं, मतलब हमारा जो नी का जो एनाटॉमिकल अलाइनमेंट है ना, हम वेल्गस कट करते हैं। सो बोन को वेल्गस में कट करते हैं। सो कट करके, और इसको जो आर्थराइटिक वेयर एंड टेयर हुआ रहता है ना, ये टिबिया बोन होता है, मतलब ये अपना लेग का बोन है, ये फीमर थाई बोन होता है, ठीक है। सो इस टिबिया लेग बोन हम कट करके अलाइन करके, बाद में वो जो कट किया रहता है ना, विल रिप्लेस इट विद कोबाल्ट क्रोमियम implant,
a foreign particle.
Yeah, a foreign particle, we will call it as femoral component.
Is it durable?
Yeah, it is durable. Say for about studies have shown that 12 to 15 years they are durable. So some with good quality implants, which are western made American components and implants, they can sustain with about 15 to 18 years with good patient compliance, to whom we required try to avoid squatting and cross leg sitting. So they are durable. The USA FDA studies have shown that, and even in India they are durable for 15 to 18 years. People are doing well, but with the time, whatever, there is a loosening happening. The component what you have fixed with the cement and all, there is aseptic loosening happening.
So that is due to friction.
Yeah, that is due to wear and tear, and cement loosening and aseptic loosening will happen with the time. But that time we can plan for another secondary knee replacement. Okay. So that's how we make sure that patient is back to his activity, just like a 30-40-year-old guy.
Great, sir. सर अनदर थिंग, अभी जो आपने बोला कि वेयर एंड टेयर से सैनुअल फ्लूइड से भी गेट्स स्लो डाउन, दैट इज लीक और स्लो डाउन. सो इंडियन मार्केट में, मतलब इंडिया के फार्मास्यूटिकल इसमें, दोज लिक्विड्स आर अवेलेबल टू डायरेक्टली इंजेक्ट इनटू द बोन, or is it the only surgery procedure?
Yeah, very good question, Tusharji. Matlab, so generally what is happening is, I told you about the arthritis. So for arthritis also there are stages. Stage 1, stage 2, stage 3, stage 4. So in stage 1 and 2 there is just a cartilage wear and tear. Okay.
Stage 1 is cartilage
हाँ,
wear and tear.
stage 1 में क्या होता है, just mild narrowing with mild early cartilage wear and tear. So stage 2 में क्या होता है, so the cartilage wear and tear is happening more. So there is a lot of cracks and happening in the cartilage, just like you see in the moon there is a small craters, no?
Yes.
So that kind of cartilage wear and tear is happening. So cartilage, there is a craters forming in the cartilage. And in stage 3, so joint space is totally narrowed down, okay? And in stage 4 there is totally bone to bone contact which forms the osteophytes, okay? So that is stage 4. Stage 1 and 2 में क्या होता है ना, so we can go for lifestyle modification, okay? स्टेज 2 एंड 3 में लाइफस्टाइल मॉडिफिकेशन होने के बावजूद भी कार्टिलेज में वेयर एंड टेयर होना है,
एक्सरसाइज
या
वो वगैरह इन स्टेज टिल स्टेज 2 इट इज क्यूरेबल,
या टिल स्टेज 1 एंड 2 द नॉर्मल क्वाड्रिसेप्स, ये सब क्वाड्रिसेप्स और हैमस्ट्रिंग स्टर्निंग एक्सरसाइज करना पड़ता है. यू शुड ट्राई टू अवॉइड स्क्वाटिंग एंड क्रॉस लेग सिटिंग, ओके, सो दैट वी आर avoiding the joint reactive forces that are happening in the knee joint to slow down the process of arthritis. Arthritis is inevitable with age, so we can slow down the process. So with stage 2 and 3, when there are cartilage craters and cartilage totally there is a loss. Earlier they used to give visco, now also they are following visco supplementation, hyaluronic acid, intraarticular injection. So this forms a new cartilage formation. And recent trends is from what 5 to 7 years, the platelet rich plasma treatment is been lot more influential, and yeah, it is giving a very wide variety and good results.
प्लाज्मा ट्रीटमेंट,
Yeah, platelet rich plasma.
इम्यूनोग्लोबुलिन्स में आता है ना सर?
नहीं सर,
जीबी
नहीं सर, जनरली क्या होता है ना, how we get platelet rich plasma is that we'll take about 30 to 40 ml of your blood, you'll centrifuge it, okay, centrifuge at about 3000 to 4000 rpm for about 30 to 40 minutes. So by doing that, we separate your RBCs, okay, and so RBC, WBC and everything will form a layers. So RBC is heavier, it will float in the lower portion, WBC and all will float in the upper portion, and your upper portion is made up of that slightly yellowish tinge kind of fluid called platelet rich plasma. So by doing this for 30 to 40 ml, we can get about just 8 to 10 ml of platelet rich plasma. So that's the ratio. So we'll filter that and just take a platelet rich plasma and inject in the joint. So by doing this, what is happening is that जो cartilage का आपका wear and tear होता है ना, so it has a rich concentration of growth factors, okay? So growth factors will go and attack this cartilage and try to repair the cartilage, and so the new cartilage formation is happening, and with lifestyle modification, cordyceps exercises and all, we can still regrow the cartilage and try to prolong the arthritic changes that are happening in the joint.
So arthritis can be cured, this is the question.
Arthritis cannot be cured, but arthritis can be slowed down because it's a degenerative process. We can slow down the process that are happening in arthritis.
ओके, सो देन टू सर, जब आपने प्लाज्मा की बात किया है, ब्लड टेस्ट हैपन in different camps or this thing. So our blood tests and our blood taken from the different camps are helpful in such activities.
It's not that. So basically, that blood test is totally different. So blood test is totally entirely different entity. The blood test what we do for platelet rich plasma is a totally different entity.
It is separate. A donor should be present.
So platelet rich plasma is given from your own blood.
Okay. This
So
was what I was
yeah. No, that's no. That's totally.
So it is my own plasma taken from some other part of the body and injected.
No. Actually, basically, so taken from your blood, your own blood. So you are centrifuging your own blood, 40 ml. After centrifuging, you get about 10 ml of platelet rich plasma. So you are injecting in your own. So donor, high chances of infection. It will usually they'll lead to infection and all. So your blood, your platelet rich plasma has good outcome over your own knee joint. So platelet rich plasma is always yours.
So our Indian sitting style, sir, as you referred that, Indian sitting style, like sitting on floor or lifting something, are they doing in the right posture? Because many cases you see in your day-to-day life. What is the best posture you suggest?
So basically, Western people generally suffer from hip arthritis. We Indians suffer from knee arthritis. Okay, because of their lifestyle. So this Western population. So basically, what will happen in Indian population is that because of our traditional background and traditional sitting on floor, okay, for doing some day-to-day activities like even eating and getting fresh up and all. So there is a lot of squatting happening. So basically, squatting करने से क्या होता है ना? So whenever you are walking on your knee joint, so about 1 to 2x of your about 1x type of your body weight is falling on the knee joint. So suppose imagine yourself is running. So that time the joint reaction forces. So basically, when the knee joint is happening, there is a joint reaction force. This is called the working mechanism. So there is a joint reaction force happening. So whenever a person is running and and all, so the joint reaction force is increased by 3 to 4x times. So imagine a patient squatting with all his weight.
Achha.
This is totally in a squatting.
There's a lot
Yeah.
of elasticity.
So there is 8x type of joint reaction forces happening falling on the knee joint. Okay. So the contact is this way, and so 8x type of body weight. Suppose you can suppose a 60 kilo weight body guy, 60 kg weight body with 8 times the body weight. It is six, 6 or 36, 6 sides of 48, 480 times the body weight, 480 kg of the body weight is falling. So imagine, so as you know now, total increased joint reaction forces is increasing the arthritic changes in the joint. It is fastening up the process. So at old age, it's better to try to avoid squatting and sitting, cross-leg sitting. So these things will help to improve the knee health. And people tend to avoid avoid running and walking because of knee. But activity will help to circulate your synovial fluid and reduce the aging process in the knee, cartilage and aging process of the knee joint. So always the remedies: good active lifestyle, good cordyceps exercise, and good running and brisk walking. These are things can.
That's great, sir. So, another thing, sir. Now, while you treat the person, you definitely use medications, lot of medications. So, how safe are the painkillers? What is the tenure? How long you tell the patient to prescribe?
All these arthritis changes, patient will have are suffering the pain from years together. Okay, whenever they consult us, whenever the patient come and visit us, they're already suffering from 2 years, 3 years, 5 years. Sometimes in village side population में क्या होता है ना, they have ignored this factors for a long time. So that time they have come in grade 4 with varus knee, as I mentioned. Okay, so basically if we start you can painkillers are generally safer for about 7 days or 10-15 days. So if you try to prolong the painkillers just for knee arthritis, it is not solving the root cause of the arthritis. It is only just the NSAIDs and painkillers have effect and adverse effect over their liver and your kidney. Okay, so in prolonged taking of painkillers is totally injurious, and even acidity, it will cause the gastric ulcers. So always try to avoid painkillers for a longer duration. So basically 10 to 15 days is handsome and good. So if you are taking etorecoxib, so about 15 to 30 days etorecoxib is also fine, because it has less of these hepatotoxic and renal side effects and gastric side effects. So that's how we.
One thing is for sure, sir. As the data or the census, we see that why women are more prone to have arthritis in this category, because men are likely to have less problems.
It's arthritis is not like we can bifurcate that arthritis is more earlier in men, more earlier in women or men. So basically, it doesn't have much of the issue. But the thing is, their body built, their basal metabolic index, and their lifestyle. So that are the main factors that can contribute to the role of arthritis. More body mass index, more the body weight over the knee joint, and more the stress over the knee joint will cause arthritis. And the activity, lifestyle modifications. So these things come into play.
Sir, now we see that there are more working class people above 30, that is till 40. They work hard for their meeting their lifestyle. So we see that there are many knee and joint pains in that age category. I'm telling that 30 to 40 years. So what is your suggestion for them?
See, basically 30 to 40 years work class is now most of the jobs are in the way that are sedentary, like sitting on the bench, working on your
Yes, yes.
systems,
Work
and
from home
yeah,
segments.
work from home category. So basically, you're totally sedentary. So prolonged sitting is obviously your joints are not mobile, so synovial fluid is not getting circulated. So there is a cartilage not getting the enough nutrition. So as a result, there is early wear and tear. And prolonged sitting is already causing stiffness over your paraspinal spasms. Okay, and also taking the load. And generally, our body is built in such a way that it's made to move. Okay, it should be continuously kept on moving. And so these arthritic issue and low backache issues are commonly increasing in the people who do sedentary lifestyle, and also in the other category of patients who do very heavy weight lifting, and these all labor class workers who are involved in the weightlifting works and all.
So, sir, what is obesity a biggest enemy of arthritis or any joint or spine problems?
Absolutely, absolutely, I totally agree with this because more the obesity means more the body mass index. So more the body mass index is taken and stressing your disc and all in the to the larger extent, because obese patients have the big belly, so that there is a lot of stress and strain over the spine spine bones and the disc. So there are more chances of causing disc prolapse. Just a normal small minor trauma, just a small road hump, so that can cause disc issues in these obese patients. And obviously obesity patients as usually have a more body mass index and a weight, so more joint reaction forces are falling on the knee joint, so more the arthritic causes early in these kind of
So,
patients.
obesity is the biggest enemy in
Yeah,
this
yeah.
category.
Obesity is a totally biggest enemy for all the main causes, all the medical problems. Okay, so that's the thing.
So, in this context, sir, can early joint pain be reversed for that age category 30 to 40 wala?
Yeah,
Because
yeah.
age old category, that is understood, that is
Hmm.
they carry a big stress and their age is also low, and due to lots of friction the bone cannot be replaced.
Hmm.
So in this category, can it be reversed?
Yeah, absolutely. It can be reversed with proper diet, proper calcium supplementation, proper nutritional intake. And these days, what is happening compared to our forefathers and our ancestors is lot of food chain is also totally adulterated these days. Whatever our ancestors and our forefathers used to get the premium quality of the foods, we are not getting those. The milk you take, it's adulterated because of hormonal, and the egg and everything is hormonal adulterated, and all the hybrid seeds, hybrid crop. So totally the nutrition value what those our ancestors got, we are not getting that. So basically now what with whatever good things it's available, some good dry fruits, good antioxidant diets, good proper diet, and other thing is moderate activity like going for a walk in the morning or in the evening, a moderate brisk walking or running. And running is a good for arthritis at this age because it's already circulating a lot of synovial fluid, and it is repair mechanism is fastened in this because of the stress and strain that is happening. So this early arthritic problem can be prevented if a patient who is in a active athlete. Okay, so this can be followed, and prolonged sitting can be avoided. Reverse it with some good spinal exercises, some good yogic exercises, Surya Namaskar, and avoid sitting for more than 1 to 2 hours continuously. Stretch your back stretching exercises. Okay, these things will help to manage your work-life balance as well as your health with regard to spine and joint issues.
Recently, we had an interview with a famous doctor, sir, for psychiatrist category. He said that stress and anxiety are leading to depression. So, in your context, sir, the stress and anxiety leads to musculoskeletal pain, because we see in more of this thing, work from home categorization, they definitely feel this due to over stress and anxiety.
Yeah, it's actually a good question. So, with regard to musculoskeletal problems, stress and anxiety will cause what? Just that there is a elevated cortisol levels in your body. Okay, elevated cortisol levels means there is a repair mechanism which is repairing your musculoskeletal issues, musculoskeletal structure of your body. Is the repair mechanism is slowing down. Okay, so as a result, when the repair mechanisms, so obviously everything is getting repaired in your body. So today we have walked, so there is a light cartilage wear and tear that is also getting repaired. So you have flexed your back, you have flexed your elbow, so there is a cartilage wear and tear. So every day, every each and every second, there is a repair mechanism happening. So this repair mechanism will slow down this, and stress will cause increased cortisol level, and as a result there is a severe rush of blood in this body. So the repair mechanism slow down. Obviously the musculoskeletal issues will start up. Maybe early spasm will happening in your body, which is so these things can happen, these things can trigger. Stress is a trigger.
So main cause is the stress.
Yeah, stress is
Sir, in another thing, sir, as you referred that the gym exercises, people work out a lot. So in that category, does joint pains happen? So what is that limit of exercises for this age category, 30 to 40 only I'm asking?
yeah, because coming to this recent trend, gym is one of the most favorite sport in this
Yes.
30 to 40 year age
So
group.
everyone wants to look nice and have a toned body.
Exactly, exactly. I do
उसके
get
चक्कर
this.
में we are losing our cartilages and these things.
Yeah, gym is good in a lot of extent for the better joint and better health of better bones and joint health. Basically what will happen with with good warm ups and good exercises, we are trying to get the joint in yeah back on track. Because what is happening is you are using the weights, you're stretching and releasing, okay, and you're doing you're making sure that something the muscles of your protein, actin and myosin, is contracting and releasing, which is good for the muscle muscle health. So actin and myosin contracts and it repairs and forms a stronger this one. So according to Wolff's law, what is stated that the more the stress, so more the bone remodeling happens. So you are lifting the weights, in the sense there is more remodeling happens, more the stress, and more the stress, more the strength for the bone. So with lot of weights and all, with now with the manageable weights, not too much weights. Too much weights can again lead to tendon injuries and ligament injuries. So with the manageable weights at your good peak and your good comfortable weights, so your according to Wolff law, your bone is getting remodeled and in a good way. So these are the things, and the deadlifts have another bad side effects. Yeah. So totally with inadequate or wrong posture, it can injure your disc and cause the disc issues in early
Early stages.
early stages.
Achha.
With inadequate proper posture of the spine, so there is a lot of stress and strain happening over the spine bones as well as the disc. So as a result, properly disc deadlifts are made in a way that you should core muscles should be in tight posture. Yes. So if there is a lot of flexing and improper posture of the spine during this, so there is a lot of stress and strain in the disc. Okay, so as a result, there is a early disc degeneration happening. So that in the young age it's fine, about 30, 35, 40 years it's bearable, and patients are managing. With prolonging and excessive weight just for the competing with others, putting overload and overweight, it is always compressing and injuring disc. At somewhere around 38, 40, 45 years, you may have disc issues, which may, if ignored, it can lead to the paralysis of the lower limbs and all. So these things can happen with the deadlifts. It's surely a uh, no brainer to go for heavy weights.
This is the mindset, sir, because one of my friend who is a gym trainer, he wants his trainees, that the candidates who he trained need to be very toned and need to lift more and more weights in his day-to-day life. So this is the best suggestion you have given, because the capacity a person holds, that should be the weight allocated to him. So in this context, sir, they turn not only these things, it is a self mindset created within us, that a guy who is lean or doesn't have a capacity to lift a weights, these category adapt themselves to supplements, yeah, like creatine monohydrate or these things, or whey proteins in a much greater segment. So are those supplements really safe which are available in India?
Uh, Basically, I would not recommend it to anyone that you should take protein diet and protein powder and all. Yeah, there are few companies which are standard in providing the good protein supplement. So basically, these protein supplements are branch chain amino acids, which are good for rebuilding this actin and myosin, these mechanisms. But it is at the initial phase they are good. They make you look bulkier. Yes. They make you look that you are gaining a lot of weights. you are getting a lot of bulk and all, you are looking toned and fit. So that is in the initial phase. So suppose they have the other side effects, that um, they are affecting your kidneys, because
Yes,
lot
yes.
of proteins will eventually cause the
Damage of kidney. That's
eventually
right.
cause the damage of
This no
overload
one
on the
knows
kidneys.
actually.
Yeah,
This
yeah.
no one knows.
Hmm.
The person who is pursuing this as a career,
Hmm.
because in later stage he won't be alive. After 50 or 60, we have seen very less bodybuilders
Exactly.
competing or having their toned body into the field.
Exactly.
Uh,
I
Lack
don't
of knowledge.
lack of knowledge. So these proteins are, when you're working out, the proteins are getting breakdown and used up if you are using good quality powder. But these at the end of the day, it is giving a lot of load over your kidneys. Okay, so leading to increased creatine levels and all. So toxicity over their kidneys. And for the professionals, they are going uh, in the area to use steroids a lot, because steroids are total adverse side effects. When you stop training, you have all the other side effects like over muscle gain, over body weight, belly and all, and somehow even noted that skin issues and all are happening, and the loss of hairs. So these are other side effects of using this wrong protein supplements and wrong steroid use.
Sir, in another age category, sir, like a teenage category. Before it was segregated till 18, 12 to 18, this segment was running. Now it is updated to 15 to 30 years, because here people are using more of screen time, mobile screen time. So are they are also affected by this screen time, because the head is something, neck, the body weight is touching out towards the phone. This is what I have heard. So how true is it?
Yeah, it's a very good question, because these days people are more prone to use the mobile in this way. Okay, obviously you will get lost in using phone and you are straining your neck. So what is happening is, you're basically consider this is your
Cervical, that is
cervical
neck
bone.
wala part. Ha.
Yeah. This is neck bones. So it's actually a lumbar disc, but your neck bones are also arranged in this way. So you are stretching and following this. Okay. So
Does
there,
our body weight come on that? This
yeah,
was the myth.
exactly.
I
Totally
heard
the
it.
body weight comes. So imagine yourself sitting in a straight posture. So you feel for yourself. There is not much weight over your neck. Imagine yourself sitting this for a long time. Suppose you sit for about 5 to 8 minutes. You start feeling that you are feeling heaviness here, some tightness here. So usually what happens with wrong posture, there is a reduced disc space which is injuring your disc and your nerves. So a wrong posture of using phone is also another thing. And the thing about phone is that you tend to develop a cognitive impairment in these children. Okay, and especially in adults like us, they have this focus. The focus time is also reducing among the people. People are unable to hear what the other person is
They are
trying to
unable to
tell.
concentrate.
Yeah, lack of
Yes, yes,
communication skills, lot of
exactly.
lack of social skills among the person. You might have seen your friend sitting and someone is in the mobile, so social life is also
Now
disturbed.
people are deciding or asking any questions to ChatGPT only. They are unable to take their own decision in life.
Exactly, that is happening. That is another that is cognitive disability
Yes.
impairment, unable to think.
So in this context, sir, does cervical collar help them to regain their independence?
Yeah, exactly. The isometric neck standing exercises and cervical soft cervical collar.
Mhm.
These will make sure that your
Because we
spine.
have seen
Uh,
our Dadaji are this type, they would put those big
exactly,
this thing.
exactly.
Because
So
now 18 to 30 people are using it in bus also.
yeah, that is happening because
Pillows
of
have come now, small round wala pillows.
so totally. This is all lifestyle modification to make your cervical spine be straight and erect in a posture. So isometric neck standing exercise, cervical collar will help a lot, and proper posture of the spine is very important.
So as you referred to screen time, sir. So what is the ideal screen time, which is really helpful for our people? And no one will leave their phones or gadgets. Then to an ideal screen time, which we would suggest.
Ideal screen time, it depends from the varies to person to person. See, someone who is a professional and working a lot over the phone, his screen time will be different. Suppose in kids and all who is playing games a lot for these days, their screen time is totally like 10 hours, 11 hours, 12 hours, which is totally unbearable. Okay, so screen time should be in a minimum for about 2 to 3 hours. That's all I'll feel. That too, to use your phone just to send important text or receive important calls. The rest, then other things, you can use your computer screens and all. So less than minimal what is required. So just to make your day-to-day life activities perfectly.
Sir, in sports category, sir, you have seen many patients having sports injuries. So why are fast bowlers having those ligament wear and tear in there?
He is running from a distance and is landing over the crease. Then he delivers the ball. So basically, what is happening? So is from running and all. When you start to deliver the ball, that is weight of the body. Weight is mass into gravity. So that mass into gravity is falling over the knee joint when he is landing over the crease and delivering the ball. So a lot of stress and strain is happening over the knee joints. Okay. So a lot of stress and strain in the sense the ligaments are all affected. So ACL and all the ligaments around the knee joints are getting strained and tensed. Okay. So with time and again, so the as you saying the professional athletes and cricket players have a lot of tournaments back to back. Okay. So there is a slow wear and tear happening. So they are more prone to this kind of knee type of injuries. And the other injury what fast bowler can undergo is the elbow. Okay. Okay. So as the muscles which is as the shoulder is totally in rotation motion, so they are more prone to the stiffness and the surrounding ligaments around the this one shoulder joint are affected. So bowlers and fielders are more prone to slap tears. So this is labrum. So whatever they are all the rotator cuff muscles. So this is the ligament. So this is the labrum. Okay.
This is shoulder muscle.
Yeah, this
You
is
are
the
referring
shoulder.
it to.
Yeah.
Okay.
So this is the shoulder joint. Okay. These are all your rotator cuff muscles which can help to lift your elbow. Okay. So as this socket is called glenoid. Okay. So this is called labrum, which is holding the your this socket. So they are more prone to glenoidal tears. So slap tears we tend to refer, and because of overuse, the over stress, there is a stiffness, and rotator cuff muscles can also get teared off. So the good thing, what is this? A good recovery and a good rest between the intervals of the matches. So that is all mandatory to relax these ligaments and prevent these injuries.
We have seen many cricket players like referring to Virat Kohli or these big names. There almost all the parts are being wear and teared everywhere. But then too there is again chances of the same part again having those wear and tears. So is it a doctor's part to go, or is it the players this thing carefulness of playing?
Yeah, it's basically to give to relax and it's a stress to try to avoid the stress intervals. Okay, a good rehab, good physiotherapy, and good relaxation and good recovery between the matches. So these are all the recommendations because these are all high intensity sports. The ligaments and all the surrounding musculoskeletal body is taking a lot of stress and strain over the matches. So perfect recovery is what I recommend is very important because with more of stress and strain, what is happening is that these ligaments are losing their there is a stiffness, and as a result, they are more prone to early injuries in between the match, in between the activity. So rapid rehab or recovery is important. From doctor's point of view and from the doctor's part, a doctor can do a successful surgery, but it's up to the athlete who takes a good care of him by following the rehab protocol, physiotherapy protocols, and rest between the internal protocols. So that's how we should go on this.
Yes, sir. So, out of the box, sir, just referring to your journey of pursuing a MBBS. So, is it true that a bright student has that capability to pursue or crack that MBBS category?
Yeah, bright student who can clear this competitive examination called NEET PG National Entrance Exam Test, who is a merit, can with a good capability and personal interest can obviously crack the exam.
Definitely. So, it was saying that a teacher's son becomes a teacher, so a doctor's son becomes a doctor. So, is it true that a doctor's hospitalization, this thing, core business is a hospital? To run a hospital, there should be a readily available candidate, that is his son, to succeed that success. So, is it the capability of the son or the father's this thing empire to take forward?
So basically, because father who is a doctor who is successful in his clinical practice as well as hospital practice, he makes sure that the hospital is taken care by his the progeny, his son or a daughter who is studying. So from their birth and all, from their childhood, it's been told that you need to become doctor, you need to study for your doctor. So they are made up and brought up in that way. So they keep visiting their hospitals and clinic. They see what their parents are doing. So they get inspired by their parents. So they find it's as a noble profession, treating and making the patients happy. They see the patients coming with a happy and bright smile to the doctor's parents who are with them. So it's totally imbibed on them. They feel that hospital environment is happiest thing for them. So there are sometimes lot of things depend on the individual tastes as well. So there are some kids as well, those don't like to be a doctor and all. Even they are sometimes pushed into this medical field. So they make sure that they somehow clear the exams, you know, single attempt or multiple attempts, and then come into this doctor business. But recent trend is that what is happening is that basically the hospital starting an hospital and running itself is a lot of competitor.
Exactly.
So even as
It
a
needs
doctor,
a high trust
yeah,
amongst
yeah,
people.
actually it needs a high trust. And earlier, you know, sometimes in 80s, 90s, even 2010s and 2005, there were very less of competitive private hospitals. So setting up a private hospital and with less competition, it was not a big challenge. So these days, even the doctor families have recognized that too much of doctors in South India. So even the doctor parents are also switching the mindset, encouraging their kids to go for the field which they are interested. Someone who is interested in music, sports, and extracurricular activities. So they make sure that they are diversifying the children who are taking up their occupation. So the trend is changing these days.
Another thing, sir, as you referred, a big multi-speciality which is owned by a father, because those days father gained people's trust. Okay, that is why he was able to grab those amount of patients to his specialty. So how challenging is it in today's world as an individual doctor without having father's boon on you? So how is this?
Yeah, I do totally get it. Directly बाप डॉक्टर था, बेटा डॉक्टर बन गया.
वो तो बहुत easy है.
Yeah, that happened, and obviously they got their own hospital setup.
Yes.
Their set of patients based on their father's reputation. So for them, they got a set of their patients, set of their own patients who are referred to the clinic. And sometimes even the patients are so comfortable with the father, they wanted to make sure that they want to consult his father's specialties, fathers only. But nowadays, it's totally technically challenging because we need to interact with the patients in a very smooth and very toned and a calm way, explain them their diagnosis, explain them their what they are suffering from. Medication can be given by any pharmacist or any XYZ person, but to explain the patient about his diagnosis, what he's suffering from, it calms down the nerves of the patient. You make sure that the patient will be very happy that I'm suffering from this, and I need to do this, I need to not do this. So that is very important when they are explained by a doctor or individual. So these days it's totally challenging for those kind of kids because patients require the good feel and a good bond between the doctor and the patient. Yeah, obviously these days marketing, social media marketing, and over enthusiastically promoting and advertising, these are actually very important in these days, these trends, because the जो बहुत दिखता है वो बहुत बिकता है, वो तो आजकल बहुत चल रहा है. So that's how I feel, but more depends on the talent and the professionalism and mannerism and the skills of a doctor. These things can attract the patients on a long course.
Sir, even I have seen that many patients in a single specialty, there will be multiple doctors. If a person is undergoing surgery, he will tend to go towards the experienced doctor. So how do you tackle in your era? Because you too need a surgery, you too need to be treated, right? In your own hands, the patient should be treated with you. So how do you tackle in your business?
Yeah, exactly. I do
trust that I should gain that trust.
Yeah. This is now it has become a totally challenging surgical practice, especially in South India, where there are a lot of doctors in each and every nooks and corners. Okay, these days it has become so difficult for a doctor that you can find a doctor anywhere, but even it's very difficult to find a plumber and a normal worker these days. So that time, so much as the doctors density has increased. Density means number of doctors for a population. So that has increased. It is challenging these days. So obviously, in a city who is a very well established doctor who has serviced done the surgical surgeries in the city for 20 to 30 years, is on a higher chance of and higher verge of getting the patients. But we as a beginners who are very young doctors, we need to make sure that whatever the surgeries we are getting out of that, we have to give a perfect and good surgical outcome, and make sure that with those special surgery, good surgery and good practices, the other next patients and the next patients are referred. So we need to make a good and clear reputation and a rapport with patient that will eventually pick.
That becomes a mouth to mouth publicity
That
for
is very
your
important.
betterment.
Mouth to mouth publicity.
Because here you are the product, but you should sell yourself.
Exactly.
This is what many movies or contexts tells us.
100%.
If there is a ready business also, if a person is unable to sell himself, he cannot serve anyone.
That is actually. Everything depends on the skill and the skill of the doctor.
So what is that oath while you leave or come out of the MBBS colleges to serve people? Because no one will be that having that boon over that head, but serving people to serving to the mankind. Money, business, these are all coming in the secondary segment. Money can be earned with any sort of businesses by doing any sort of works. But you are serving a person who is literally a person in need in today's segment. So what is that oath you get from the colleges?
Medical professionalism always aims to be a noble profession, means treating others. So treating others who are suffering from any of the ailments, illness, pain, or some other issues. So obviously our doctor's life is totally sacrificed. Okay, we make sure that even something or the commitments, or we make sure that we attend the patients and make sure they are happy and they are cured. So basically, we follow the Hippocratic oath. Is first do no harm. Okay, even someone that should be strict among the doctors, because first do no harm, as Hippocrates said. Why it is important? Because if you are skillful enough, please do the intervention to the patient. If you are not skillful enough, just try to refer without causing any much more harm to the patient. These days, all those local practices and all, so unaware patients, they are just injecting the steroids, XYZ things to the patient, doing the harm sort of things. Yeah, to get more money only. So these malpractice are more in these days because of over competitiveness and a lot of doctors, even the other field of doctors or pool of doctors who are entering the city.
Is it so that finding a groom or this thing girl in your you prefer in your same segment, because a person who is not into that profession doesn't understand your busyness or your schedule?
Yeah, personally and basically speaking, yeah, because a doctor can understand the doctor struggle. See, suppose a newly formed doctor who are newlywed, they understand the struggles that are happening initially to setting up an patient rapport, starting an OPD, from starting an OPD to starting a small hospital setup. So that struggle will be compensated by the person who is a doctor. Suppose it's totally based on the mindset of the person, but these things are happening among the doctor community. A good person can good vibe, who can understand better can also go good hand in hand, but professionalism matters a lot.
Sir, another thing, sir, now you most of the time you think about patient post surgery also. So mano ki you have done a surgery by 6 or 7 p.m. in the evening, so you will definitely think overnight that what is the condition of the patient, because as you have walked out of the that's OT theater, operation theater, you think that the operation is successfully done, but after that there is a chance of getting him to a worsen condition. So there is definitely some negativity, having a chances of negativity to the patient. So there is definitely molestation in your segment also. So how do you counsel to the people if something happens to the patient overnight, because that is not your take or that is not your part of the caregiving condition? So how do you tackle people with you, because you should be a good counselor also in this?
Exactly, this is very important. So basically, whenever we admit a patient, whenever we prepare a patient for any surgical intervention, we make sure that we inform the patient priorly the complications, okay, the pros and cons of the surgery, what the surgery is going good for them, and what is the disadvantage of getting operated. So explaining the patient and their attenders the risk and benefits of the surgery, that is very important, clearly telling them. Okay, and this is the age of a modern era. So whatever surgeries we are making, whatever we are doing, we make sure that we document it in the media or a phone. Okay, videos are done of the surgeries. We make sure that we show to the patient post operatively. So this surgery has happened, this has happened, so that they gain the trust over us. They gain the confidence over the, yeah, this doctor has performed this surgery very beautifully with videos and all. Yeah, and after gaining this trust, yeah, these complications, post operative complications are part and parcel of the surgery or any medical intervention you do. Okay, so when we are communicating to the patient in a very good and a beautiful way, so there are lack of misunderstanding, but sometimes there are very aggressive patient
Yes,
attenders.
that is what I
Yeah,
wanted to ask you.
so those who come and try to,
Yeah, physically assault doctors
yeah,
also,
physically
because recently in Hassan Medical College, drunk man, beat the doctor. So this was the case because a doctor cannot sacrifice his profession and go to into that profession and hit him in return.
exactly, this can happen only in India. Yeah, these things will keep happening in India. This will happen in India. Have you ever seen these things happening in the western side, western part? Their doctors are too worshipped in a professional way and too much, and there is a lack of doctors, more of demand of the doctors, so they are respected. So here in India, a lot of doctors and all, so lack of civic awareness among the people, which is making them do such things. So this is totally condemnable. Yeah, what I feel that patient as a doctor he can't do those such things, but obviously he can make sure that things to protect himself by taking a good backup of the security personnel who are around them. And recently there have been some good laws have been formed on destroying the property in the hospital, molestation of the doctors. So these strict laws have to be implied and imbibed everywhere. So the such things will rapidly go down. And more importantly is having a lot of good civic sense among the people and good security personnel staff around the around the hospital area. These things can be prevented actually, but as a doctor he can't go to their level and do such things because it's not to the good character of a moral conduct of a noble profession.
So how do you handle, sir? Because when a patient, when you counsel everything and tell him that okay fine, this is the surgery, leave it surgery, this is the procedure of treatment we are giving you. कई बार क्या होता है कि patient does not respond or the patient caregiver stops it, because in today's this thing India, more of chiropractic practitioners are there. There are many people tell that is Ayurveda. That is not Ayurveda actually. People are not even certified to that Ayurvedic level. Then too there are some medicines which are available, jati booty or these things. People tend to move themselves to that era wherein they stretch their hand and put it in a joint surface again and fix it with a lot of pain. A minimal this thing momentum is found in the body. So how do you place yourself into such tough situations to regain the patient's trust?
Exactly.
That is again in the civic sense category.
Yeah, it's not more of civic sense, it's about old traditional practices. Yes. These are all the so-called traditional practice. We as a man, we used to live in forest. That time they used to do what? Whenever they notice there was a fracture and all, they used to put this, make sure that bamboo sticks are in, okay, and apply this tight, yeah, cast type, so that it's immobile and all. So these things are still in practice. What is that making is that it's totally, we are totally aware the science has advanced, the it has progressed and all. The usually that local practices is destroying them in another way. Tight bandaging over the fracture site will make them to lose the neurovascular continuity. So as a result, there is a lot of neurovascular compromise, lot of this one nerve paralysis and issues, and vascular compromise is happening. That is leading to the lot of ischemic changes. Ischemic means ब्लड सप्लाई कम हो जाता है इसमें. सो एज अ रिजल्ट कभी कभार क्या होता है, जो टाइट बांधे रहते हैं ना, टाइट ड्रेसिंग एंड ऑल, बिकॉज ऑफ दिस ट्रेडिशनल प्रैक्टिसेस. सो देर आर थिंग्स दैट टाइम वी नीड टू एम्प्यूट द पेशेंट, एम्प्यूट द हैंड or amputate the forearm. So those things are has happened, but we need to make sure that we need to understand them with good awareness and good among the public. That can be prevented with long run.
So another thing, sir, now while you treat people in India or you compare your friends or colleagues who are working abroad, so we are always underpaid. This is the mindset. and you take in any categories of work professionals. So what is the fair pay that you refer here as an individual practitioner or a person who is handling an institution or a government supply? Because persons earning potential there in western countries are more respected and having their more safety over the doctors. Here there is very I'm not condemning India's system. It is a system wherein involved with more of civic sense also, as you referred, and more of mind changing activities done within the patients, because counseling is done at your end also and with the hospital's end also. So how far, how correct is it, the amount of this thing taking from India?
See, the very thing about the overpaid or underpaid, yeah, compared to some Western countries, we might have seen about some instances in, whereas in Canada they are trying to tell that the salary is overpaid. They are trying to cut the salary and pay back to the government and all. So these things happen in the Western, yeah, Western side. There are obviously more paid because less doctors are there, and doctors are in more demand. So to get an appointment, also patients are waiting for 1 month, 1.5 months basically to get some simple OPD appointments as well. Here in India, there are a lot of doctors and all. Uh, Underpaid, overpaid, yeah, there are. It's slightly. I feel that there is slight underpayment is there. So institution and all, this MCI come and regulated this institution payment for the category of the doctors they are hiring.
Age category or
Not age
experience category?
on the professional category, senior assistant, assistant professor, associate professor, and professor, and head of the department. So they have MCI stepped in and made sure that as per the guidelines, these professional practitioners, based on their degree, based on grade of the work they are doing in a department, so they are paid in that way. So that is scrutinized and monitorized. Okay. As well as in private practice and all, yeah, at Indian setup and all, we need to compromise our rates and all to benefit the patient, or else too much higher costly and higher values will tend to lose the patients. That is happening. We should balance and see the things. I feel that, yeah, based on the economic condition of the patient, doctors are slightly underpaid, but in private we should capitalize and manage the things based on the patient's category, and make sure that treatment is available at their comfortable monetary benefits.
Because why I ask the question is, in hospitals also, that and this thing, a UPSC this thing, administrative center is there, like Khan Sir's. This is what I recently just now surfed in Google. He has made a multi-specialty hospital in Bihar, right? So his surgery or post-operative costs are very low compared to any government hospital. This he said a statement that in India everything is costly. Mainly health system is very costly.
Yeah, basically the health system itself is costly.
To the patient, I'm telling you, referring to the patient, because patient is the ultimate payer.
I totally agree. I totally agree. See, Tushar, if you are seeing based on the infrastructure of the hospital invested everything. Okay, hospital has made the infrastructure, made sure that beds are available for the patient based on the ward category, based on ICU admission, the other benefits like oxygen, ventilators, mask, cylinder, other things which are important in ICU setup. So exactly, based on the hospitals are not only made sure that they are run in nil profit business. Yeah, hospital setup itself is made sure for the profitable business. So uh, based on the affordability and all, patient can choose their type of hospital, type of their ward or category of the. So patients are not in any frame of mind that this is costly, that they can choose based on their affordability. That is
and
very
quality
important.
of
Yeah, quality of
treatment.
Treatment, exactly.
Sir, after that, we have seen that fractures happen. When fractures do occur with a patient, people treat it with POP, so, or some cast or these metals like this thing, inversions. So, do you think that if the fracture was treatable, fractures were treatable, then too some doctors tend to move them the patient to the surgery level? So, is this organized commercialization towards the doctor's view?
Actually, Tushar, to be precise, there are fracture as a category. Some are displaced or undisplaced fracture. Okay, basically undisplaced fracture can be managed with immobilization. So when a fracture happens, we tend to follow these four things: RICE therapy, rest, immobilization, elevation, ice pack ablation, and elevation. Okay, so these things will help to heal the fracture. If there is a undisplaced, rest means the sense we are
Should
giving the
not move the body here and
not
there.
move the body.
That's
Immobilization means we are applying the slab to the part of
slab,
the
plate,
slab means POP. It is a
POP.
half. It is a half POP, which is covering the half circumference of your limb. Actually, to be precise, there are two types of fractures. One is displaced and another is undisplaced fracture. So basically, undisplaced fracture are managed with the RICE therapy. So one is rest, other is immobilization, and ice pack ablation and elevation. So rest means imagine the patient is having the fracture of this distal end radius. So this is a radius bone. He has a fracture of this wrist bone. Okay. So that time what we are applying is we are applying a POP slab. Okay. So it is undisplaced fracture. So we are giving the rest by doing the immobilization. We are putting the POP slab. So totally it's a half circumference and we are doing the immobilization. Okay. So half circumference means there is a chances of swelling. So we are not making sure that the swelling is not compromised here. So then after about 7 to 10 days we are putting the cast application. So in the sense that is immobilized for 4 to 6 weeks and that fracture will heal. So other is the displaced fracture. Suppose this same patient had the displaced wrist bone fracture. So that time what we had options like putting a K wire without opening the skin. We are just giving the traction in the OT under the anesthesia. Okay, and we are putting a K wire and getting it under alignment and then putting a cast. So that is the display. Other thing is we are opening. If it is not getting reduced by this, it is a totally combination. There is a lot of fragments in the bone. So that time we go for plating. So fracture has a different type of set of management for different kind of fracture based on displacement or undisplaced. Yeah, there are some commercialized hospitals or depends on a commercial lot of commerciality. So sometimes because of this money being a manufacturer in the margin, some they try to do it by surgically. So that is some of the slightest malpractice that is happening these days.
So we see that in terms of healing, as you said, that rice this thing therapy. So it is a therapy wherein in China people tend to move themselves with a cup therapy. That is a fire under a glass bowl. They give it to the spine and these cords, wherein a patient gets relaxed or revealed with the pains management. So how do you segregate it in your own practice? So is it fine for them or is it just a temporary therapy?
So these are all act on based on the soothing effect of the patient. See, uh, patient is having a spasm, he goes for a cupping therapy and he feels fine based on the soothing effect of the patient. So it's like just taking yourself as in terms of you are applying a analgesic this one. You are applying a local ointments or for your spasm. You feel it's giving soothing effect over your body for some time. You feel good, and the next day again the pain kicks in. So it's not a acting on the core root cause of the issue. So these are just based on soothing effect. Just you got a backache, you get it, your physiotherapy done, shockwave diathermy, interferential therapy and all, ILT, SWD, shockwave diathermy, intermittent lumbar traction. So just the way these are all the things that are acting superficially, but they are not acting on a root cause. If it is giving a soothing effect to the patient, some patients choose it. But as a clinician, as a diagnostic surgeons, we make sure that we always find the root cause and treat it.
No, sir. After that, as you said, that massage and oil was introduced in India because they were doing it since the person were like nomadics. Now ointments have been introduced too. So how effective those ointments are there in today's therapy for pain management?
Yeah, pain management ointments will act on the local delivery system. Okay, so they apply a local ointment, local delivery. So local pain is compromised for some time.
It is just like ice therapy.
Yeah, it's just like a local simple soothing effect based on your soothing effect and your mindset. So it will not act on the underlying cause as I mentioned earlier. So it can relieve pain for some times, but it's not acting totally what's the cause.
What is that fracture that should not be ignored? Whether it is this thing, if the pain is also reduced.
So basically the all kind of displaced fracture. So sometimes malunited fracture of the wrist, which is totally ignored these days in the village setup. So they have ignored the fracture which is malunited, and the pain kicks in and the wrist pain. So these wrist fractures and elbow fractures. So whatever the intra-articular fractures that are happening, so those things I feel that they should not be ignored. They should be taken a consultation and get the medical advice from your local consultant. That's what I feel. And so never ignore the red flag signs whenever you get a fracture. So you get the swelling, tenderness, and inability to use that part of the limb. Okay, so these signs should not be ignored. So if you are lazy enough, after 2 to 3 days, if you feel that these things are not getting reduced, kindly consult your consultant, get some necessary aids, or get it investigated by using some x-rays or the necessary things that can help you in the long run.
Sir, one thing, sir, just on a curiosity, what is that scarcity, or what is that operation or the orthopedic surgery you scare a lot?
Yeah, interestingly, all the intra-articular fractures which are complex and comminuted fractures means the bone is broken into many pieces. So these are called comminuted fractures. So intra-articular comminuted fractures that may be around, maybe at any point, elbow, or any wrist, any elbow, or the knee joint, distal femoral fractures, these kind of distal femur fractures, okay, which are comminuted, and both the condyles are displaced and comminuted. These are very challenging type of fractures. So we need to be very meticulous in our approach, and meticulous in our approach and implant positioning and reduction of the fracture. So these are challenging. And worst, intertrochanteric fractures. The intertrochanteric fractures are fractures that happen around the hip joint in the trochanter region, somewhere in the intertrochanteric region, and subtrochanteric, somewhere below the lower side of the knee joint. So intertrochanteric fractures are those, this happen in this area. Okay, these kind of intertrochanteric fractures which are complex, and the subtrochanteric fractures which happen in this area. So they are totally challenging. And complex ankle fractures. So these are some of the surgeon's nightmare, which requires meticulous approach and a surgery to fix the joint, to get back the intra-articular congruity, just like a normal anatomy.
Sir, we see in general practice that people usually Google themselves. He is the first line doctor in his point of view. So, do people still Google and give you suggestion that this was the thing happened to me in your daily practice?
Yeah, I've seen many young persons, and who are technologically oriented. I've seen getting the patients who have got a complex meniscal tear. They themselves get the MRIs done. They themselves start telling me it's a complex tear. How should we fix it? How arthroscopically will fix? They are already done the survey. They have seen the videos and they have come. And I had seen one interesting patient who was telling me, talking about the red zone between the meniscus, because so usually there is a red zone, red white zone, and white and red zone, because red zone is somewhere in this area. Okay, so that is very close to the arteries. So that kind of red zone, that tears will eventually heal. So somewhere if you are going inside, there is no articular supply which is going in this is red zone. This is somewhere red white zone and totally white zone. So tears in this area will heal very slower. That kind of tears should be fixed. So you was even telling me those things. There are some, what you can, educational googling and coming and telling, that makes us happy, but there are uneducational. So whatever, if you google in Google will tell you lot of everything, from basic till you have the very biggest thing in the world, like you have a cancer as well. So that will the mindset. So always seek the help of the practitioners. So lot of myths and disbeliefs are circulating around Google. Someone will type something that will all be displayed in the Google. So never trust Google very blindly. But there are some aspects, if you can educated enough and you can take some help, but always take a help of a medical practitioner.
So, what will be that calcium rich foods, doctor, which you want to suggest to people?
Yeah. Uh, calcium rich foods are is available in all the type of green leafy vegetables, and you can take the help of milk, cheese, yogurt. So these are good in calcium rich. All the seafoods and seafoods, for non-vegetarian, seafoods are very rich source, and mutton, and especially the marrow, the cavity, what they the bone marrow, whatever they take in is also rich in calcium rich diets, and even the dry fruits what we take in. So these are also very rich in calcium. So these are some calcium rich diet they can inculcate in their daily diet.
So any suggestion for D3, doctor, which is naturally available source, then to it is in a form of food or this thing, you can
So
suggest?
so best source of vitamin D3 is the sunlight. As sunlight is a natural source of vitamin D3. Always get yourself exposed in the morning sunlight, early morning sunlight, and somewhere in the evening time of very mild that ultraviolet radiations at that nanometers. That is very good for your D3 supplementation. So always try to soak yourself in sun for about 20 to 40 minutes in a day. So that will take care. You might have seen our farmers and all the people who are working in fields for a long time. The sports person, how strong they are, how hard they are. So exposure is very important. D3 supplements with 60K per weekly supplements can be taken for the sedentary workers like who are working in indoor, can't expose themselves for outdoor activities.
Thank you, doctor. And we would like to have a quick fire, rapid fire round with you. Just answer will be in one line, yes or no, or fact check. So joint pain is a normal part of aging.
Yes,
And sitting on floor, is it good or bad?
bad.
Gym versus yoga, which one is better?
For overall well-being and balanced mentality, I think yoga is good. And for to build your muscle strength, muscle mass, and your strength and endurance, gym is good. Both have their benefits.
And cracking knuckles
That is a normal physiological process that should be done under very safety precaution.
and knee replacement last forever.
Yeah, the component can last about 15 to 20 years based on the usage of the patient and their care what they are taken. So basically USFDA says 12 to 15, 16 years based on the component you are using. And
So pain means damage.
no, pain can be of any other causes.
So supplements can replace this thing, our dietary exercises.
No, dietary exercises, see, that's what I was referring about Wolff's law. The more the stress you take on the body, the more the physiological stresses you take, that is the remodeling happening. Take for a bone or a ligament or something. Okay, with exercise, if you compensate with a good nutrition supplement, that is important. Only taking in the nutrition supplement will not help you. So that's should be balanced. You might have seen somewhere that it's about 70% is the exercise or workout, 30% rest is the so 70% is the diet, and 40 to 50% is the gym, exercise, recovery. So these things should be followed.
Thank you so much, doctor. Thank you so much for the wonderful insight given to the people. And thank you so much for your time in
Yeah, pleasure. It's been my pleasure.
So this was our video which was really insightful, and hope this video will be circulated amongst us, and do like, share and subscribe. Thank you for being part of this video.